Hi, my name's Johnny Martin. I'm one of the ICU anaesthetic consultants at Addenbrooke's. And I'm just going to go through now what we suggest the core kit should be for the intubation of a straightforward COVID-19 suspected or proven patient. What this isn't designed to do is to tell you or show you how to intubate a patient, nor is it designed to change what standard operating procedures you have, merely to identify the parts that we would like to change for safety and ease of throughput for these patients. So the kit we've got on the table is what the emergency department have put together as their straightforward pack A, if you like, for intubation. And I'm going to take you through this kit and kind of explain the various components of it. We've got a standard bag valve mask water circuit or Mapleton-C circuit that I'm going to take you through in a second. We've got something you might not have seen before. This is called inline suction. This is something we use in the intensive care unit for the closed suctioning of patients' airways once they're attached to an endotracheal tube. We've got a mask. I presume there'll be a 4 and a 5 standard mask. The endotracheal tubes that we use on the intensive care, you may or may not be familiar with, they're identical to a standard endotracheal tube with the addition of this little yellow tube that enables us to suction any gubbins that there may be above the cuff of the endotracheal tube, and this is called a sacket tube. This is what we'd advise. If a patient is anticipated to stay in the ICU for more than a day or two, we would always change to this. So to avoid the need for that, we'd really prefer that this tube goes in as a first stop. Gum elastic bougie, fairly standard. A yank your sucker. A 10 ml syringe for inflating the cuff, and we'll come on to the cuff and what we do for it. And some gel to lubricate the tube. We've got a disposable laryngoscope, Mach 4, Mach 3 blades. We've got some nasal oxygen to pre-oxygenate our patients. We'll talk about that as well. We've got a tube tie. We've got some Goodell airways appropriately sized, so the standard sizes for adults. Some capnography tubing. This is the tubing that's connected to the machine that senses the CO2. And then we've got a HME filter, and we'll talk about these in a second as well. We've got a tube tie, and we've got a little adapter that enables us to plug the capnograph tubing to the machine if there's no luer lock adapter on the back of an HME.